All right, welcome everyone. My name is Ben Palmquist. We're going to get going in a few minutes. This is the workshop Forging Strategic Partnerships with Broader Multiracial Movements. So if that's what you're looking for, you are in the right place. Good to see everyone. We're going to give people a few more minutes to dial in, but if you're, you can go ahead. We have just some polling questions to try to get a reading of the room, who's here and what you're interested in out of this session. So at the bottom of my screen, there's something, a polls/quizzes icon. Do other people see that? No, let me see, how do I, oh, launch. Okay, I've launched it. I'm hoping that means it popped up on your screens. Are people seeing a poll? Okay, so feel free to fill that out while we're waiting. We'll get going in a few minutes. Welcome, folks who are just joining us. This is Forging Strategic Partnerships with Broader Multiracial Movements, and we're going to get going in just a few minutes. As you're waiting, if you like, you can fill out the polling questions. We're trying to get a sense of who's in the room and what you want out of this session. All right, welcome folks who are just joining. We'll get started in a couple minutes. Welcome, everyone. This is Forging Strategic Partnerships with Broader Multiracial Movements. We are going to give people another minute to call in, and then we'll get going. All right, welcome folks. We'll get started very shortly, about 30 seconds. Give a couple more people a chance just to join the room. All right. Hello, my name is Ben Palmquist, pronouns he, him. I live in the Bay Area and I'm calling in today from my brother's place in San Diego. I work with Partners for Dignity and Rights. We're a national support organization for grassroots movements for healthcare and housing, workers' rights, and education. And my co-presenter today is YuLing. YuLing, do you want to introduce yourself?
Hey everybody, my name is YuLing. I use she, her, or they, them pronouns. I'm wearing a white mock neck shirt with dangly earrings and have short buzzed black hair. My background is a wall of signs and patches with various social justice messages. I am based on Canarsie and Munsee and Lenape land, colonized as Brooklyn, New York City, and I am the co-director of the Campaign for New York Health.
Great, and we were hoping to have a third presenter today, Maribel Nunez from California Partnership, who's done a lot of work for Healthy California in the fight for Medicare for all on the state level in California. She's unfortunately not able to join us today. So you all are stuck with just me and YuLing, but I think we'll do our best to sort of share what we know. And I know there's a lot of really knowledgeable folks in the room. So we're also gonna open it up and create space for everybody else to sort of share and ask questions and think together. So this workshop is forging strategic partnerships with broader multiracial movements. And so in a sec, I'll go over our agenda. Just a couple sort of housekeeping things before we get going. Please feel free to engage in the chat. I know it's a lot in these sort of virtual conferences to be sitting behind a screen the whole time, and we want to try to make this as interactive as possible. So please feel free to say hi to folks and pop in questions and just sort of affirmations, just whatever's coming up for you. I see some people are answering the poll, which is great. We're just running this at the beginning just to get a sense of who's in the room and what you're looking for out of this session. So I'll give people a few more minutes to fill that out. I think it should either pop up on your screen or you should have a button at the bottom that says polls and quizzes. I've not actually filled one out before, but I think it's visible. And so let me go over our agenda quickly. I'm gonna share my screen. All right, there's too many things on the screen. All right, I hope folks can see this. So I'm going to share a bit of framing for the conversation just at the beginning, go through that pretty quickly. And then we're going to jump into campaign spotlights. So YuLing's going to talk about the campaign for New York Health and some of what they've learned and been working on over the years. And I think they're just doing fantastic work in all fronts of the campaign. As I'm sure people know, they're quite close in legislatively to actually passing the New York Health Act, which is tremendous. And that's built on multiple things. And as we'll hear from YuLing, including a lot of really deep and intentional work to sort of build alliances with the labor movement and with immigrant rights movements and other movements in the state. Then we'll move into some discussion. So first, YuLing and I will have a little conversation, ask each other questions to draw out some sort of more nuances, and then we'll open it up to everybody. So I'm thinking what we'll probably just do is a big group Q&A. But if folks are interested, we could also try to do small group breakouts. So I'll ask you all when we get to that point, what would be of interest. So again, you can fill out the survey, engage in the chat with each other. I thought there would be a Q&A option, but I think you can ignore that and just engage in the chat as we go. So to open up with a little bit of framing here, we, thinking of ourselves as health justice, and in this I include certainly our organizing for state and federal Medicare for all, but also reproductive rights movement, environmental health movements, there's a public health, there's a lot of work within the broader health justice movement. And we, of course, are situated in a broader context in which we're all really a part of something larger than ourselves, right? So I like Mark Dudzik from the Labor Campaign for Single Payer sometimes talks about us as, oh shoot, now I'm the health justice wing of the larger movement is essentially, I think, is how he frames it. And I like that. And so, this diagram is already an oversimplification, right? There's not just one racial justice movement, right? It's really a sort of constellation of sister movements, environmental movements, immigrant justice movements, global justice movements, gender justice, economic justice, labor, and there's others I know I've left off here. So this is just sort of a shorthand way of sort of just trying to situate ourselves, right, within this larger context of people who are organizing together for the dignity and rights and justice of all people, which I find really inspiring to know that we're not alone in this stuff. So why do we want to build movement? When I say build movement, I really mean sort of like build deeper relationships and strategies together and sort of sisterhood with our other movements. I would say that, on one level, it's a moral necessity, right? None of us live single issue lives. We all need healthcare, but we also all need shelter and clean food and water and safety and a lot of other things. And we care about other people. And, for many millions and millions of people, as we know, healthcare is a sort of front line on the top of their fundamental needs and is a daily struggle. And for other people, it might be housing, it might be safe work, it might be a number of things. And it's also, I think, a strategic necessity to build movement together. So people in society are complex, right? Some people are primarily motivated by sort of to seek health justice, and for other people, they have a different entry point. It might be immigrant rights, it might be gender justice, it might be a number of different things, but we know that everything's connected. In our movements, I think we very often face the same opponents, right? So the corporations that are, overcharging us for healthcare and denying us the care we need, that are squeezing healthcare workers, are the same, sort of private equity firms and investors that are squeezing workers in warehouses and all sorts of other sectors. And at the end of the day, I think we just don't yet have enough power, the power we need to really win Medicare for all, right? So we need each other, and people in our sister movements need us too, right? So there's I think, real compatibility. So going back to this sort of framework here, I mentioned that health justice is actually a sort of a constellation of movements. And so again, this is just a shorthand. This is not a definitive list, but within our health justice movement, I'd say, there's certainly all of us who are fighting for Medicare for all, both at the national level and in states like New York and around the country. Other folks are really fighting for health for all, to make sure that all immigrants, regardless of immigration status, are included in our healthcare system. There's fights around Medicaid to expand it, to stop work requirements and other exclusionary practices. There's environmental health movements, work to win culturally appropriate care, vaccine and medicine justice, nursing homes, hospital closures, reproductive justice, healthcare worker fights. So, there's a lot of us involved in this work. And I think to varying degrees, many of our organizations sort of, we have nurses unions in the room. A lot of people sort of sit at some of those intersections. I wanted to share, this is a sort of a framework I learned from Nijmi Zarinko, who's a fantastic organizer with Put People First Pennsylvania. And I find it a really helpful sort of mental map for thinking about where do we sit in our relationships with these other movements right now. And so Nijmi differentiates tactical alliances from strategic partnerships. And so tactical alliances can have value, right? There's times we may want to do them. And I think many of the relationships we hold with other groups falls into these categories, but they tend to be a little more thin and shallow. They're often a little bit more transactional, like if you endorse this thing, we'll endorse yours. If you show up at our action, we'll show up at yours. They can be often a little more impersonal or professional, or simply professional, just sort of people emailing each other, having sort of courtesy in their relationships. And they're, at the end of the day, tactical in the sense that they're really just about sort of reciprocity and just discrete actions in support of one another. So there's a role for that. But what I want to suggest is that part of what I hope we can sort of all figure out together how to move towards a little more or deeper strategic partnerships with our sister movements. So with other sort of health justice movements and with movements more broadly, and we're going to be talking a bunch today in particular about immigrant and racial justice movements, which I think are really, really central to building the movement we need in a country as racially and ethnically diverse as the US. And so strategic partnerships are thick, they're deep. So they're just more robust in terms of sort of how we're engaging with each other. I think of them as being transformative, meaning that they're sort of, we're not just sort of signing onto a letter or something, but they're actually, if we're engaging authentically in transformative relationships with other groups, they end up changing our own work a little bit and our own orientations too. And so there's I think require a bit of a willingness both to to be moved, even as we're seeking to move other groups as well. I think they're often built on very deep interpersonal relationships and mutual trust and love for each other. And so there's, there's a really important human dimension. They are definitely sort of oriented around strategy more than just tactics. So not just what's the next action we're going to do, but what are we trying to achieve in the world and how do we think we can get there together? And they're time intensive, right? So all this stuff takes a lot of time to build in, which means that we can't build a strategic partnership with everyone. And not every group is sort of, are we aligned enough with that we would even want to try? So, both of these have value, technical alliances and strategic partnerships. And I think in the storytelling that YuLing and I will do a little from the campaigns we've been involved in, we'll try to draw out a little bit of sort of what that looks like in practice to concretize it. So I'm gonna wrap up in a sec here. But I just wanna, as YuLing is talking in a moment, I'm about to hand over the mic. I just wanna put out a few questions to sort of keep in mind to listen for in what she's talking about. And then I'm gonna share some of what I've seen as well from the state campaigns led by the Vermont Workers Center and Put People First Pennsylvania. And so as we're talking, listen out for some of these things. What specific sister movements are we talking about? Are the relationships we're describing, do they lean more towards that strategic partnership end or more towards the technical alliance end? What issues are we connecting around and what tactics are we using in these campaigns we're talking about? And how actively are we working across lines of division? And I'm thinking especially about across lines of race and ethnicity and immigration status here, but that could also be disability, it could also be age, it could also be geography, it could be a number of things. So I'm going to stop there. And YuLing, I will happily send things over to you.
Thanks, Ben. Okay. So Ben, please interrupt me if I start taking too long, as I haven't fully timed this out yet. But I wanted to start just by explaining a little bit. The Campaign for New York Health, we're a statewide coalition dedicated to passing and implementing legislation for guaranteed universal single-payer healthcare in New York State. We are a staff of 2. On the slide, you can see my co-director, Ursula Rosem, who I think many of you in this room know. She's based up in Syracuse, and we are also both part of the New York State Poor People's Campaign Coordinating Committee. And, standing on the shoulders of those who came before Ursula and I, and many of the people in this room also, we are so proud of this beautiful movement and that it is in fact a statewide coalition from North Country in New York to Buffalo, to Troy, to Elmira, Hudson Valley, all the way to the east end of Long Island and in New York City as well. And we have nurses leading the way, especially New York State Nurses Association alongside 1199 SEIU, Committee of Interns and Residents, some of the largest healthcare worker unions in the state. And we have physicians, med students, social workers, home care workers, other healthcare workers with us. More than 500 businesses, worker cooperatives, and freelancers statewide in support of guaranteed healthcare for all. Faith leaders as well. And some celebrities and electeds, both state and congressionally on board. And I think also we have hundreds of political grassroots service, community organizations, unions statewide as well. So thousands and thousands of New Yorkers and folks nationwide in the Medicare for All movement, right? We want to see states make healthcare a human right and lead to Medicare for All nationally. And of course, this statewide campaign, this beautiful movement that we've been building and that we're building was all over time. The campaign itself was conceived not until 2014, though our New York Health Act bill was introduced in 1992. The first public hearings in 2015 were, to be frank, white liberals reading statistics about how fiscally responsible the New York Health Act is, and not much else. Though that is an important step forward, right, to even have a public hearing about the New York Health Act. But through a lot of intentional work in 2019, over, from 2014 to 19, we had historic public hearing in 2019 that instead of just in New York City, they were all over the state, and they went on for more than 12 hours. They included dozens of testimony from those closest to the crises, and included how health is interlocking with food security, with housing, with disability rights, and more. So that was a huge change, and didn't just happen and certainly didn't happen overnight. And so some of the, for the Bronx hearings, for example, it was integral that we had developed a strong relationship with one organization in particular, the Northwest Bronx Community and Clergy Coalition. And this is an example, I think an amazing example of how to work with a partner organization. Several years ago, we had a screening of Power to Heal, paired with a discussion about racial justice and immigrant justice, women's rights. Northwest Bronx couldn't make it to that event, but they saw we were having it. And so their lead health justice organizer, we had a one-on-one, then we had a deeper dive with their health justice leaders so they could take on the organizing themselves of giving the New York Health Act 101s themselves, organizing, canvassing, power mapping the Bronx delegation of legislators, collecting and developing people's healthcare stories. And then we had a New York Health Act 101 with dozens of their members. They have monthly meetings, 100 people come to them. And the health justice leaders of that organization led the meeting. You can see them with the large Justicia banner in the slide. And then we had a smaller roundtable with local organizations that focus on immigrant and racial justice to talk more deeply about how our work is collaborative and how we can collaborate. Then also Northwest Bronx, they have also a housing justice team. And so they, after about a year of focusing on the New York Health Act, they themselves started talking with the housing justice team and talking about how the New York Health Act relates to their work and how we can work together with them and the public housing work that they're doing. And that relationship is still developing. It's developed a lot, but there's still a lot of work to do between the two movements. And you can also see that they helped bring into the movement as well. The New York City retirees, union retirees, are fighting to keep their Medicare in New York City because there are many retirees who might believe that healthcare is a human right, but didn't engage with the New York Health Act or Medicare for All quite yet, until New York City decided to move all their public sector retirees off Medicare and onto Medicare Advantage. And so NWCCC, Northwest Bronx, this organization, as an example, were able to help bring and engage those retirees. I see some of you in this room, hello. To engage more on the New York Health Act and connect the dots between New York Health Act, Medicare for All, and their fight against privatization of their Medicare. And now NWVCC is also expanding their single payer work into bringing in their youth and public education and defund the police committees to work on the New York Health Act as well, and also their voter rights and democracy groups, because they see universal single payer healthcare as expanding our democracy, right? Democratizing our healthcare is good for our democracy. And then we also work closely with the New York State Poor People's Campaign. Together, we came to prioritize healthcare and housing because they help us, all those things that Ben was talking about earlier, right? Build power, break silos, unite across differences, expose our common enemies, help us shift the narrative and narrators, all of these things that help us build a mass movement of those who have the most to gain, right? From overturning the interlocking evils of racism, militarism, ecological devastation, and poverty. And that work, there's many evolutions and phases to how we've collaborated with the New York State Poor People's Campaign, and how much they have instilled and made our movement so much better as well. So we can talk a little bit later about how that work has changed and evolved and adjusted. And our work together spread then to the Housing Justice for All statewide coalition to see how we have the same enemies, and that not only is our healthcare and housing intertwining, like not only is housing is healthcare, but how our solutions should be collaborative as well. I'm going to move a little bit more quickly. Then another example of cross-movement solidarity that we've also seen lawmakers respond to positively. For example, with the Fund Excluded Workers campaign, the Invest in Our New York campaign, we created a Compassionate New York bill package. Housing Justice for All, Campaign for New York Health, and the Justice Roadmap coalitions came together to demand New York State legislators pass the Compassionate New York package of bills to respond to the public health crisis. And that included guaranteeing healthcare for every New Yorker, stopping unjust evictions, and decarcerating our state. And it worked in a lot of ways, but we are still struggling in a lot of other ways to make this like authentic solidarity and not just tactics or shallow tactics. And the Campaign for New York Health, we are working hard on incorporating more political education within our grassroots and partners and with legislators, that passing the New York Health Act is more than just health policy. It's more than just what happens at the doctor's office. We love to bring up, you can see the quote on the slide from Dr. Rhea Boyd, who is a pediatrician and public health advocate based in Oakland, California. And she says, racism works to fracture and scatter families and communities. And for us, we connect the dots that the current healthcare system is one major structure that upholds and enables white supremacy. And here, together, we're saying that mass incarceration, guaranteed healthcare, and housing as a right, for example, affirm Black life in particular, and create infrastructures for compassion, opportunity, stability, and well-being. So that working in coalition and finding authentic solidarity is important in order for us to win the things that we need. I'm going to skip over some of this. One other, I think my last example that I'll talk about up front is breaking silos even within the health justice movements. Right, our legislators, the ruling class, they want to divide and conquer us. They want to pit us against each other. And so we see that a lot in even just within just the health justice movement where, you know, for a lot of reasons, right, it's structured this way that we sometimes have to fight in these silos. So it's hard to break them. But we created a Go Bold on Healthcare platform, which helped bring together those who are focused on more stopgap measures and understanding together why those stopgap measures are important, though they may be incremental and temporary, and relating it to how we also need to fight for the New York Health Act and single payer healthcare because it is systemic, long-term sustainable change. I think I will stop there.
Thank you, YuLing. I've heard variations of this storytelling from the Campaign for New York Health over time, and every time I'm just as inspired. So tremendous set of work there. I'm seeing a question. Will we be able to share slides? I can certainly do that. Are you okay after this, YuLing, sharing slides?
Yeah.
Great. So we can do that. We'll send them out to folks. And I'm going to ask you to hold questions for YuLing, and I'm going to just jump in here and share a little bit more about a couple campaigns we work on. So my day job is with Partners for Dignity and Rights. We are based in New York City, but I live in California. We have staff around the country, and we're really set up as a human rights organization to support grassroots movements around the US and even to some extent around the world. And so we've been working since I think around 2007, 2008 on the fight for healthcare, starting with the Vermont Workers Center and their campaign, their Healthcare as a Human Right campaign there. And over the years have worked with a bunch of groups, the Campaign for New York Health and many others. But two of the groups that we work closely with, and I've actually been a member of, are Put People First Pennsylvania and the Vermont Workers Center. So I'm just going to share a bit about some of the lessons I've learned from like organizing with people on those campaigns. Put People First Pennsylvania is they don't call themselves a healthcare organization, they call themselves a human rights organization, but their primary campaign is the Healthcare as a Human Right campaign. And they actually democratically, the members selected that as their focal point at their first annual membership assembly because they are committed as an organization to organizing poor people across lines of race and geography. And they identified healthcare as, you know, a human right that we all need, that speaks to people so directly, that is a powerful moral movement. And so they've been campaigning for healthcare ever since. At the moment, they're not pushing directly for for a universal healthcare bill in the state legislature because they've identified that they don't yet have the power to do that. So they're working on some other campaigns, including fights around Medicaid to stop cuts to Medicaid and to actually expand it, and fighting for a public healthcare advocate, which is a vision that the members have come up with for a new state office who would rebalance power in state government by serving as a direct advocate for people to provide individual assistance for people who are getting screwed over by insurance and hospital and other companies, and also to work with legislators, testify in court and things on behalf of people's healthcare rights. But to reground us here in sort of some of the tactics and strategies I think they've used that I've seen be really effective for building deep partnerships with other movements. A lot of the work actually begins internally, just amongst doing education and stuff amongst their members. So one of the internal political education projects they have is called Leadership Across Difference. And so this is really a sort of involved, hands-on, practical sort of approach to anti-racism in particular, that looks at sort of structurally how racism is often used as a divide and conquer tactic to pit, divide poor people from one another, obscure our commonalities by suppressing Black and brown people and immigrants as well. But how that operates as a tool essentially of the ruling class, right? To sort of create this imaginary situation in which it's okay to deny some people healthcare. And so a lot of that work begins with this study internally. There's the workshops often involve lots of scenarios that are actually drawn from sort of tensions that have come up among members over time or with other organizations over time. And so they do a lot of really deep workshopping together to try to sort of among each other build sort of shared understanding that really acknowledges differences, sort of different people's different lived experiences based on their identities, but rather than just sort of stopping there, then says, okay, how can we come together and find unity and solidarity through that? So I think that's been a really powerful basis for sort of what's enabled them to then bridge with sister movements. Similarly, internally within the organization, in their base building, they use organizing committees where they have members organized into local committees in different counties and regions around the state. And they conduct projects of survival, which are things like free health clinics where they'll test people's blood pressure, help people sign up for Medicaid, do things like that as a way to sort of directly connect with people. And then they do a lot of one-on-one mentoring. So every member does 2 one-on-ones with another member every month. They have another leadership institute for about half a dozen people every year. And these are for, really targeted to people who are poor and working class and haven't had a lot of access to formal education and training to really sort of help people grow into powerful leaders who are able to organize and educate others. And then they do community care as well, where, sometimes people have a housing crisis and it makes it hard for them to follow through in organizing that month. Or sometimes, very often, of course, it's a medical crisis or, surprise bills or things. And so they've created structures to show up for people so that members can help each other get through those tough moments and really support people and their family members as well. They also do learning together with, not just within the organization, but actually with partner organizations. So one of the things I think is really cool is Put People First, primarily for its own members, does monthly educational workshops. These are all on Zoom these days. But they also invite some of their key partner members and staff from their key partner organizations in. And so it's a way to sort of deepen that sort of shared political understanding and strategies together. And at their annual membership assembly, they similarly invite core partners in. So there's usually at least a half dozen organizations. I think actually the Campaign for New York Health, if I recall, has sent a couple people at times to attend some of their events. And so there's, it's a lot of people from in-state in Pennsylvania, but people from the Poor People's Campaign and other allies from other states as well. And so that, that helps deepen strategy, but a lot of it's really just about relationship building. And so putting people actually sort of in conversation with each other to hear from each other and learn together, sort of as we're doing this weekend together. And then, all that so that they have that foundation of sort of the internal shared understandings and values and political commitments of their members. Then they have these relationships that they're building and this sort of beginnings of co-strategizing together. And I think those really form the foundation. And then on top of that, they're able to actually layer these joint campaign strategies and tactics and actions together. So as YuLing mentioned, in New York, there's a Poor People's Campaign, similarly in Pennsylvania. And so Put People First has actually is co-convening the Poor People's Campaign there. And so bringing together several organizations around the state, including immigrant rights organizations, prison abolition organizations, different groups that are, working on different issue focal points, but really are building a shared vision together for what a more just state looks like for everyone in Pennsylvania, and then figuring out, okay, how can we sort of strategically build power together, organize our base, wield power in Harrisburg and the capital. And so they're doing some really powerful work. Put People First is actually also, it has a steering committee, which is essentially its governing board, and it's actually invited some core leaders and staff from some of these other organizations to sit on it. So they've actually opened up their governance structure to this sort of co-governance model, which I think is really interesting. You wouldn't want to just do that willy-nilly with anyone, of course, but it's sort of after having laid the groundwork of building some of the trust and these mutual relationships, that's a step they decided to take, and I think it's been quite successful. And then they do wage some joint campaigns together. So every year they're in Harrisburg sort of fighting for welfare rights alongside healthcare rights. And, sort of there's a number of things that come up in the state budget every year. And so that's an annual push to make sure that human needs are being served by the state budget, which isn't always sort of the default. And then they sometimes have some sort of, these are not totally separate from the larger healthcare campaigns they're fighting, but for example, there was they joined together with an environmental justice organization and a prison abolition organization in southwestern Pennsylvania, where they had learned through their members that a state prison was actually situated physically on top of coal ash from an old coal mine, and that this coal ash was actually poisoning the water there, and which was affecting people who were incarcerated in the prison. It was affecting the workers in the prison, and it was affecting the surrounding community. And so this was an intervention point they realized where all their organizations fighting for health justice and environmental justice and shrinking prisons were able to join together and really push to the state to do something about the situation. And so, it's been hard going. They haven't, their overall goal was to close the prison, and that hasn't happened. But I think that still the process of organizing together, learning together has been a really powerful one that has helped sort of grow each of those sort of sister movements together. And turning to the Vermont Worker Center, they sort of also work in these sort of similar areas of work. So back in 2007, 2008, the members actually went through a really interesting political education process together to evaluate when we say healthcare is a human right, what does that mean to us? And they looked at a whole bunch of principles that are often used in international human rights law, but sort of sorted through those and tried to figure out which are the principles that really speak to us, to our vision, to our values for the healthcare system. And they ended up settling on 5 values, 5 principles: universality, equity, transparency, accountability, and participation, that spoke to them internally. But then the next step they did was to broaden out from their membership base to coalitionally. And so they convened, this might not be quite the right name, but there's something like the Human Rights Coalition with sister organizations in the labor movement, in the disability rights movement, and others around the state. And they used the principles as a way to actually sort of build consensus together. So they had, some meetings among staff and core leaders to make sure they were finding alignment. And then they actually hosted a statewide assembly, which was a big organizing and base building opportunity. And the principles formed sort of a central organizing structure for that whole assembly. And it was a way that they could bring people who were primarily focused on disability rights or union organizing or other things to making sure that they were focused on health justice and vice versa. People whose primary intervention point was health justice, thinking about workers and people with disabilities and others. They also have, similar to Put People First, regular political education for their own members. They call it the People's University for Learning and Liberation. And similarly, they invite sister organizations to participate. So I've actually been through this program myself. And when I was there, about half the group were disability rights advocates. And it was really, really great to learn with them and from them as part of that training together. And then all this sets them up to do joint strategy and action with sister organizations. So I mentioned that the human rights framework has been an important internal political tool. And so one of the ways they've used their principle of equity, for example, is to really build a commitment internally amongst members that then enables them to be a strong force in the state to say that, no, they're not, like, state legislators are not going to strip immigrants, documented or undocumented, from our healthcare system. And they've really built strong internal commitment to that. And I would say that, Vermont is a fairly white state. Most people are American-born citizens. And so, like, a lot of that work has happened amongst people who themselves are not immigrants, but I think it's been a really powerful way of doing, sort of in that, to use Put People First language, building leadership across differences and really building that solidarity. And so they've done that internal work. Then they've now, over the years, built a really close relationship with migrant justice, or Justicia Migrante. They actually share an office in Burlington, Vermont now. They do show up for each other's actions. That's a really important thing, to your point, Nick. But around that, they're also doing a lot of sort of mutually supportive things. And so back before, in 2011 was the year that the Vermont Workers Center managed to pass Act 48, which is the big act that said, we, the state of Vermont, are going to create a universal healthcare system. As we know, that hasn't yet been financed, but it was nevertheless a big victory. But there was a moment about a month before it passed where a Democrat and a Republican in the legislature teamed up to try to pass an amendment that would have written undocumented folks out of the bill. And so they immediately, members of the Workers Center, members of Migrant Justice, because they had done all this legwork together, were able to team up and show up at the Capitol, have an emergency rally, get a ton of press coverage, make sure legislators knew that this wasn't going to fly. And they were immediately able to strike down that amendment. So it was a really powerful moment in the campaign. Similarly, they built really deep relationships with SEIU, the state employees union, and other unions in the state. And one of the places that comes up is every day there's a big May Day rally, which is always sort of connecting the dots between workers' rights and health justice. And again, as YuLing mentioned, the Poor People's Campaign in the last few years has become a vehicle, sort of building off that earlier human rights coalition for just creating a space where core leaders and staff from some of these organizations are able to come together and strategize. So I am going to stop here. And we've both been doing a bunch of talking, so please feel free to start putting questions in the chat, but I'm gonna kick things off. Sorry, YuLing, I'm just trying to find my notes, by tossing another question to YuLing. And I was wondering if you could first speak a little, just from a personal vantage point, about this. So what motivates you to do this what is often sort of hard and long-term work in general, but specifically with sort of building these relationships and these sort of deep partnerships with sister movements in New York. So I see you pouring a ton of your heart and soul into it, and so I'm just curious what motivates you in that.
Thanks, Ben. So I could say that I was naive and thought we could do this in just a few years. But I'll share, though my parents had me marching in the streets and like stuffing envelopes and faxing like faxing people to come to organizing meetings for Taiwan independence. They were Taiwan independence activists since I was in the womb. I didn't become an organizer for local affairs until November 2016. I'm one of the new activists. And in November 2016, I went to every kind of meeting I could to, figure out what could be done, where do I fit in? And I ended up at a Democratic Socialists of America socialist feminist meeting. All of those things that I did not identify with at the time, didn't know much about any of it. And that's the first time I learned about single payer. And more specifically, I heard about the New York Health Act as being one of the most comprehensive bills for single payer in America. And it immediately clicked for me as a racial and economic justice issue, and which racial justice was at like the top of my mind. And just being a person of color is at the top of my mind. But I saw and understood health intertwining with every aspect of our lives, not only our physical and mental health, but our financial health, and how all three of those arenas of our lives are so intimately connected, and how universal single payer healthcare we were talking about it earlier, it removes this significant haze and fog. It removes an entire white supremacist industry from our lives, making space for us, giving relief, sustainable relief, and making space to thrive. And then just personally, I was able to understand over time that, someone I love like a sister is in an abusive relationship. She can't leave because she needs her spouse's insurance for herself and their kids. I myself, I have accepted I had accepted up to 2016 that I just can't get physical therapy for my wrist injury. So I'll never be able to play the cello again. And was just accepting that that's how it was, right? Because we're so indoctrinated to accept the status quo. Or even to more serious things. I love playing the cello. It's fine. It's a leisure activity. But also how, I would love to be able to have mental health care for myself, or how it's been a saga. In January, I had a miscarriage situation, and it's been quite a terrible saga to even just see a doctor for a follow-up from that situation. So yeah, I'm in this fight for all of those people and myself. And it's impossible. We can't have racial and economic justice without universal single payer healthcare, and we can't win universal single payer healthcare without understanding that we need it for racial and economic justice, and that we have to win that together.
Thanks, YuLing. Just another question, and YuLing, feel free to turn this around at me as well. But I know you've been working on sort of some specific intervention points around long-term care. You've been talking about housing justice, compassionate care. Could you sort of speak to one of those, about sort of a little more of some of the nuts and bolts of how you in the campaign were sort of able to do some relationship building with other organizations and movements?
Yeah, I think most immediately of how, when we worked with a compassionate care package that was decarceration, housing, and healthcare, it was definitely very hard. It was a challenge, right, to balance between the transactional things that we could do with each other, and if it was of value or if it was strictly shallow. And they were both. There were lots of times that they were both, or one or the other. But what was important was that the people involved, the movements involved, the leaders involved, we did trust each other, and we did build some we had mutual respect and trust. And so we were starting from a place of authenticity, but it was just hard. We were trying to do it too quickly, I think, is part of the problem too. At the beginning of the legislative session, we're like, hey, we should get together. We can do this. It can be a press stunt, right? It can be a splash. And we put together a report about how much money these three different bills would save across decarceration, housing, and healthcare. And our legislative session is really short, right? We really only have, it's about 6 months long, but we really only have about 3 months to get anything in the budget, and then 2 months to get anything outside of the budget passed. And what happened was, I think it was the beginning, the transactional things that we did together. We showed up at each other's rallies. We retweeted each other. We were definitely a really great retweet alliance. But we didn't get to the point where we were actually doing political education with each other's memberships, with each other's movements of, for example, not just how housing as a right equals health, good health for people, because good housing means that they don't have lead in their walls and their water, or that evictions kick people out, and that people have to choose rent over healthcare, right? It's that we have a common enemy that's shuttering our hospitals, that's upholding the prison industrial complex. It's these more systemic reasons of why we need to work together, but also, connecting the dots, that stopgap measures, and that there are definitely acute, immediate needs that need to be addressed too. So it was just a lot to try and do while we were in the legislative session in a short amount of time. But what that has led to is, over years, like with Northwest Bronx I was talking about earlier, that work that I explained, from the one-on-one to them incorporating their housing people, incorporating their voter, incorporating their youth and cops not counselors folks, like that was a span of, I guess, 6 years now. Yeah, 6 years now. So it definitely was not overnight, and it took a lot of intense conversations and time.
Yeah, it is. We all know this is long-term work because there's no shortcuts. I want to bring in a question from Bree. I hope I'm saying your name right. Who says that my main concern is regarding organizing and activism is, how do we get people to think outside the capitalist box? How do we get people to realize that change is possible, to move from individualism towards solidarity, towards community and public health over self-advancement and materialism? So I think that's a great eternal question. And I think, some of what, just to draw out, I think some of what YuLing and I are speaking to is sort of this is really, you're describing a wholesale ideological and mental and cultural shift, right? And so that's, I don't think there's one single answer to that. There can't be. But I think a lot of what we've been finding in these campaigns helps is doing this deep political education at multiple levels. So, setting up trainings and studies among members internally in organizations, to really sort of try to pick apart the pieces and get folks comfortable to a level that not just to sort of like read about something, but actually be able to put things in their own words so that they can then go out and talk to other people and carry on organizing conversations around this. So if somebody's sort of talking about housing or whatever their starting point is, helping sort of connect the dots and the questions we're asking and the things we're bringing into the conversation. And then I think, again, sort of bringing in these sort of looking at the points of connection with specific other organizations, like through that political study, and actually doing some of that work together with these other organizations of figuring out, where does housing connect with healthcare? What are the, whether it's people's struggles to pay monthly rent and medical bills at the same time, or lead in the wall, in the paint in the walls, or whatever it is. I think those are some of the answers I would offer. YuLing, anything you want to add to that?
Yeah, the Campaign for New York Health, we definitely, and we learned this from Vermont Workers Center, from Put People First PA, the Poor People's Campaign, that we root our work in our stories. And that's a lot because, what we hear from a lot of the most marginalized groups that we've been, that we try to court into the movement, that the universal single payer healthcare movement is really white. And also that they feel like people come in and talk at us, like we're talking at people and we're telling them we have the solution for you. Whereas we're trying to shift our advocacy to be much more rooted in our stories and having discussions. I think everything goes back to talking with one another to understand each other's experiences, right? That's how we can know that we're not alone, but also understand where the gaps are and where we connect, but also where there's differences, and unite across those differences, right? And so for the Campaign for New York Health, we incorporate a lot of storytelling trainings. health equity and racial justice forums, and relationships with what's happening locally, whether it's hospital closures, worker strikes, police violence, the opioid crisis, eviction defense work. And also emphasizing, because it's really hard, or it's really easy rather, to get swept up into the legislative session or electoral work, or like the nonprofit parameters that a lot of us have to work within. So we try to bring it back to, when we look at data, health stats for an area, that it's not just about the data showing that there's health inequities, but it helps us understand what is happening in a particular area or to a particular demographic that points to what the needs are, and that we talk with folks directly about their experiences with healthcare and what their needs are. And then we think about, okay, does single payer address this? Where does it connect to? Where does it fall short? How can we make it better? So always bringing it back to someone's healthcare experiences is what has been most important in being able to build coalition.
Thanks, YuLing. I'm going to go to a question to Beth, and then Marlene, I see your hand. We'll go to you next. So Beth asks, could you go into more specifics of how to build those relationships with different groups to work together and grow movements and power? So I think YuLing just spoke to one piece that they've found really helpful is sort of rooting things in people's personal experiences and personal stories is one strategy. I really like actually what in the chat Rita and Sally are sharing about listening, asking for questions, ask what they need rather than talking about your goals. So I think that works in a lot of situations, right? Like if we're having a one-on-one base building conversation, same thing. But I would say, yeah, if we're reaching out to another organization, maybe we don't have a relationship with, one starting point would just be to like think about, are any of our members connected with them? Do we have sort of mutual, connections existing? And even if not, if you're sort of starting cold, I think listening is super important. So figuring out what are their goals, what are their values, what are their priorities this year, and then sort of, doing that work together, figuring out like, okay, well, here's some of our goals. Can we find sort of commonality between these things and find the points of synergy, right? Because if we're not going to sort of just convince anyone to just drop what they're doing and jump wholly onto Medicare for all organizing any more than they're going to convince us to drop Medicare for all, right? And so, but I think in that listening, we can find points of connection. Anything else, YuLing, you want to add to that?
I guess I'd want to add that, I guess it's elaborating on what you just said, that sometimes you're just planting a lot of seeds here and there. It could be a conversation, it could be a cold call, it could be seeing someone at their action, right? That you're there in support, and then seeing them at different actions over and over or in different meetings, and then building on that to have conversations. And that some of those plants will grow immediately and some of them will take 5 years, right? So it's all moving at the pace of trust, as I think it's Adrienne Marie Brown says. And also, because universal single payer healthcare, of course, in our minds here, right, it relates to everything. You also have to prioritize, because we can't coordinate with every single movement or every single organization. So definitely prioritize, right? You power map your organizations and what is most strategic in comparison to our capacity, right? There are those pragmatic things to consider. And that sometimes you'll just find the person that totally aligns and totally gets it and has the capacity, and then you like, it's amazing, right? It's just amazing from there, and you grow it from there. And sometimes jumping into those seemingly shallow tactics, right, they don't have to be shallow, right? They can be building blocks to do more. Yeah.
Yep, I'm saying affirmation both in the chat and from nods. Marlene, you have a question?
Actually, not so much a question, but offering what we've done as far as involving equity and not having many Black people or brown people as part of our mission. And what happened is a very astute group put out a survey into the Black community about what their actual experiences were when they went to a hospital, to a doctor's office, just how were they treated differently or less respectfully than others. And that gave them great information about what really is going on. And based on that, the equity committee put together, the survey with some statistics about how people were treated. And they went to the hospitals and they met with hospitals and they informed them about this and what are they going to do to correct the situation. And I think that this was a really important step in trying to engage this community, because heretofore, I don't think they ever had a voice. They never had a voice. It was a whole bunch of white folks. These are the people that you want to talk to. These are the people who have been terribly hurt by the system. So surveying, I think, is very good, and then follow it up with an action.
Thanks, Marlene.
Mhm.
Okay, YuLing's tossing me a question. Can I speak to how Vermont and PA incorporate mutual aid and projects of survival into their advocacy work? Yes, so these are not sort of tactics that these organizations have invented. There's long traditions. I think about the Black Panthers and many other organizations over the years who have really done mutual aid projects as sort of a core part of their work. And so I think the idea behind it is that, one, people are just struggling on a daily basis just to meet their needs and live decent lives. And so like people need support. But can we do that in a way that's not sort of charity, right? That we're not sort of like doing something on behalf of these poor, decrepit people, but as actually sort of like, we are all in the same boat. Some days, some people are struggling more than others. And so how can we show up for each other collectively? And to do that as part of a political project too, right? Where we're helping people sign up for Medicaid, but at the same time talking about, well, why isn't it that all of us aren't just guaranteed Medicaid as just a fundamental right? And so some of the specific tactics I think that they've found useful over time are, one are these, I mentioned having free clinics. And so sometimes like nurses or other people will volunteer to do basic like blood pressure screenings and other sort of basic medical tests. And it's a space you're sitting down with people in 2 chairs and you can start having a conversation, right? So it's a really good way to connect with people. And these days, like especially right now, I don't know if folks have heard, but the federal government is about to end the prohibition on disenrolling people from Medicaid and kicking people off. And they're about to bounce it back to states. It seems like as soon as July, as many as 16 million people across the country could be kicked off of Medicaid all at once. And so it's just like a devastating, looming blow to people's lives. But it is also just like there's a real need to do some organizing around it. So Put People First, for example, is starting to plan a series of projects where they'll go out in different counties in the state into strategic locations in front of clinics, in front of grocery stores, social services offices, where they think that people who are Medicaid might be. And they're going to help people sort of educate them about their rights, provide them with some written information, collect people's contact information to do follow-up, help people if they're not enrolled in Medicaid, help them sign up on the spot. And so it's a sort of form of direct service that really ties into the larger campaign. And so other people on the call may have examples too, but I think that's been a really powerful thing. And so, but they used to try to do it a little bit ad hoc and each organizing committee would try to figure it out. But I'd say one of the things they've learned over time is that it really takes a lot of concerted, maintained effort to make this stuff happen. And so they've actually formed statewide teams. So they have one, Put People First, as a community care team, which is doing the sort of direct support for members who are struggling through crises. And then they also have a projects of survival team, which is supporting these local organizing committees around the state and actually carrying out these projects of survival. Sorry, I'm not keeping up with the chat as I'm doing this too. Any other questions people want to bring into the conversation here? So Padma is asking for clarification. This is all 50 states and the territories, I suppose, too, Padma, are potentially going to kick people off Medicaid. But what the federal government's doing, so in March 2020, it put a hold on various things. It said you can't evict people from their homes, you can't kick people off Medicaid, you can't do all this stuff during the pandemic. These were framed as emergency measures. But now what they're saying is, ostensibly the emergency is over, and so it's okay for states to kick people off again, which is preposterous. But they're basically delegating, it's a return to the pre-2020 status where states could sort of disenroll people as they saw fit. And so, they still have to meet the minimum federal requirements of, if you're below 138% of the poverty line, et cetera. If you're pregnant, you have to be enrolled, but anything beyond that, they can choose to disenroll people. So the fight will now be turning, to all 50 states, I think. And so, predictably, the states that have been dragging their heels on expanding Medicaid are going to be some of the first to cut people. So I know in Pennsylvania, for example, there are already at least 4 bills that are trying to introduce work requirements and immediately cut people off and prohibit them from reapplying and doing all this draconian stuff. Whereas in Vermont, just given the partisan balance at the moment, there's nothing immediately in the works. So it's unfortunately one of these sort of red state, blue state things, but I think it's going to lead to a lot of fights in our states.
Thank you so much. Oh my goodness.
Yeah, but I think there's still time to try to get out in front of it a little bit, because we have sort of a few months warning here. And so it's going to be, a lot of people are going to be struggling and will be hurt. But I'm hopeful we can do some organizing and sort of hold ground where we can. Let's see, other questions from other folks? YuLing, are you in? I see Marva on the line. I don't know if there's other folks from New York, but I'm wondering if you want to invite anyone else in to say a few words about the work there in the campaign.
Oh yeah, I mean, Marva, if you're up for it, please join in. And I see Julie Schwartzberg. Sorry, I can't see everybody though.
There are 3 screens of us, so you might have missed some. First of all, I'd like to say what a joy it is to be working with YuLing and Ursula. I'm a member of PNHP as well. I sit on their board. And when you talk about coalition building and working with groups, it's, for sure it's going to take all of us to get the work done. In 1992, it was Neisner that approached Assemblyman Gottfried with the concept, along with others, of everybody in the state of New York needs healthcare. And he picked up that banner and he's been carrying it ever since. And as I put in the chat, he's going to retire, boo. And his replacement, for those of you who might want to know, is chosen by Hasty, who is the Assembly leader. So we don't have any idea who's going to replace Dick Gottfried in the New York State Assembly, but he has done more than anyone that you can imagine in moving forward the New York Health Act. So we have a mantra here that instead of giving Dick a gold watch, we want to give him the New York healthcare. We want passage of that as this going away gift. So the work is always continuing. Neisner, which I am a past president and do a lot of work. I chair our single payer committee right now, along with some others on here. We have found that if you want to get anything done, that one hand clapping doesn't work, that you need everybody in all kinds of groups, and not really to be put off by whatever label people are coming with. I mean, people are put off by some labels that other people have, but we're all individuals. And all of us, I guarantee you, everybody I'm looking at here, including myself, is going to get sick and need medical care. So we are very much all in this together, no matter what. And we are obligated to do our best, not just for ourselves. I'm kind of selfish, but for, you know, people in our family, people that we love, that all of us are going to get sick and we're all going to be in need. So working together is the only way to get anything done in this country for sure. So thank you, YuLing. And thank you, Ben, for blowing me up. I guess wearing all this red didn't help me this morning.
I always enjoy hearing from you, Marva. Let's see, Julie, I see your hand.
Hi, can I talk now?
Yes.
Oh, okay. I wanted to underscore a couple of things that YuLing said. And just for a quick background, I'm a New York City retiree. I think it was mentioned that the city decided to take away our Medicare, give us a terrible Medicare Advantage plan, and to save money on our backs of the sickest, oldest people. But I don't even know if YuLing remembers this, but I'm a member of a neighborhood organization called Good Neighbors of Park Slope. She came and spoke there, which is one level. And out of that organization came our great organizing committee. It started after she spoke. So just in terms of connections, also to underscore another thing, they show up, single payer shows up at all our demonstrations. And that's to underscore the thing of being there. You don't have to be talking or whatever. You just see the people are there. And the other great thing is half the people in our group are saying now when we deal with our specific issue and it gets settled and hopefully it will be positive, everybody wants to work for single payer. So, you know, I just wanted to point out that kind of development and how these coalitions work together. So thank you. And thank you for the great presentations.
Thanks, Julie. That's a great example of what YuLing was saying about planting these seeds. And sometimes it takes years before they bear fruit, but you never know. Let's see, are there other questions? I'm sorry, I'm having a little bit hard time tracking all the chat while we're going. So feel free to raise your hand if you'd like to ask a question. I see a question from Bree about combating mainstream media. I mean, that's always a big question. I feel like we could do a whole nother workshop on that. But I don't have a full answer, but I'd say some of the stuff YuLing was talking about, I think really stands out to me. So sort of rooting a lot of our strategy and storytelling, you know, making sure we're getting our own message out there through our own forms of media, you know, social media, newsletters, public speaking, having events, trying to sort of create our own media coverage in that way, feel really important. You know, there are times where it makes sense to publish op-eds and letters to the editor and push back against journalists and others who are doing sort of bad framing. And I think especially the supporting members in writing can be a really good leadership development activity. But I'm a little sanguine, I guess, about the possibilities for directly changing what the mainstream media is doing. And so I think there's a more promise probably most of the time in us telling our own stories through our own platforms and getting that out there. But I do think that, you know, each of our platforms is limited in scope. We don't have, you know, a ton of resources or capacity. And so building these connections with other movements can potentially be a way to amplify, right? So that we're not just telling a story about Medicare for all in isolation, but that it's fitted in with a larger story that other groups are amplifying as well, that connects the dots across all facets of our lives. And actually that reminds me, early on, I saw people chiming in with questions about how do we finance our movements? And again, this is like, I feel like that needs a whole nother workshop. So I'm not gonna be able to provide a great answer, but I don't know, I would welcome anyone who wants to jump in here, but just trying to connect that to sort of these themes of how are we building with other movements. I think one of the risks is sort of winding up in competition with each other, of sort of having fundraising turf battles and stuff. And so, sometimes that's going to happen, but to the extent that we can sort of build more mutual trust and solidarity, I think that can open us up to, maybe it's applying for joint grants together, maybe it's doing a joint sort of mass grassroots fundraising effort, using social media or other strategies. I'm not providing a great answer to your question, because that's always a challenge. And it's one we're all struggling with. All of our organizations are underfunded. But yeah, I think trying to avoid those sort of turf wars, those funding turf wars, feels like an important part of the question. So I feel like I'm just adding to the question rather than answering it. But I'd welcome YuLing or anyone else to chime in with thoughts. And we just have a few more minutes, so this might be our last question. And I see Bill has a follow-up question. How successful have any single payer groups been with getting grants? I think next to nothing, I think, is my experience, that we have zero funding directly for this work at our organization. I think it's really grassroots fundraising seems to be the, people are way better than foundations and politicians on the issues. And so there's a lot of people who care, and that's where there's more potential.
The Campaign for New York Health, we get a good amount of money from a couple grants, but one of the grants we're not allowed to lobby for a particular bill. So it's very interesting, and the obstacles that we have to come to a decision at some point. Is it worth getting the money from the grant when we have to work so hard to build something within the parameters of the grant? And for us, we've been able to put that into storytelling trainings, which works both in the service of the building the movement for us, even though we can't use it specifically saying we need to learn our story so we can pass the New York Health Act. It still serves as building the movement. And so we still work within those parameters, but I wish we could just not have to apply for grants and work within the grant project parameters. Yeah. But as Ben said, the Campaign for New York Health too, our movement is powered by labor grants and also our individual donations.
Thanks, YuLing. And so with that, I think we're just about at time. I want to respect everyone's time. Really appreciate you all tuning in, sending love to our third speaker who wasn't able to make it, Maribel Nunez, and really appreciate you, YuLing, stepping up and just sharing this wealth of learning and just great work that you all are doing in the campaign there. And thank you to Julie and Marva as well for sharing. So thank you, everyone. It's always great to connect. I'm really always inspired to be part of this movement with you all.
Thank you, Ben. And the last thing I would say is we don't want our healthcare to be dependent on any political party. And that is one of the reasons, right, that we need to build this mass movement across movements, across all the differences. Thank you so much, Ben.
Bye.
Thanks so much. It was really informative. You did a great job.
Thank you.